Hi, this is Dr. Sushma, consultant dermatologist at Anaha Derma Ortho clinic. So today we'll be talking about fungal infections because this has now become a huge problem in our country. It is like an endemic right now, and we see day in and day out there are a huge number of patients walking in for these infections, treating themselves on their own, or picking any random creams from the pharmacy or suggested by some friends who've already suffered, and landing in more stubborn kind of fungal infections. So now let's look into what we can do, how we can avoid it, and what are the causes of these fungal infections. So what are the causes of these fungal infections? First is it usually comes because of excessive sweating. So if there is accumulation of sweat in certain areas of your body, you see that the infection tends to occur in those areas, especially under the chest, groin regions, your armpits. So these are more common areas where you see. Then you see because of overcrowding, people living in crowded areas. Then because of poor hygiene, not taking a bath for days together in these kind of conditions. In members who have a family history, there's something known as a ping-pong theory. This can occur either where multiple family members have the infection, or you're living in a hostel with multiple people having these conditions, where one person is being treated and the other infected person is not getting the treatment. So the affected person now tends to infect the other one, and then the cycle keeps on going. So this is what happens. And the other reason is excessive use of these steroids, your Itchguards, your ringworms, your Saibol. And the other reason is not completing the full course of treatment. This leads to resistance and recurrences of this infection. So how to identify this infection? So first thing is there's excessive itching, then there's redness in those areas. You'll see that there's a ring-like lesion with some central clearing, then there'll be some scaling, maybe sometimes there may be a secondary infection if there's a long-standing infection. So what are the common areas that you see? Firstly, this infection can affect any part of the body from head to toe, but most commonly the areas that are involved are your sweat clogging areas, such as your armpits, under the breast, between your thighs, your groins, your buttocks. These are the more common areas. So people wearing occlusive footwear constantly, they can land in having infections of the feet, or sometimes you see infections of the hands, of your palms. Then you can also have infection of your nails. In kids, the more commoner areas is your scalp. So how do you treat your fungal infection? First thing is consult a dermatologist, must and should. And next thing are certain general measures that you can do in order to avoid getting the infection or not having recurrences. First thing that you can do is please stop sharing the soaps with your family members who are infected. Okay, and then stop sharing your towels or washing all your clothes together. Stop using these steroid creams or any pharmacist recommended creams, or any of your friends or parlor people just giving you random creams left and right, because all of them are laden with steroids, some foolish combination that can damage your skin. And then next is first maintain proper hygiene. Take a bath every day. If you can do it twice a day, even better. Prevent excessive sweating. Wear loose fitted clothes, usually prefer cotton wear. So once you have any skin condition, please consult your dermatologist. Do not treat yourself, because your friend might be suffering with something else and she might recommend a cream for what she was using, and it might not be that condition with you. It could aggravate, it could actually completely damage your skin. So one thing is when you come to a dermatologist, we first evaluate to see if it is a fungal infection or not. And if it really is, then we treat it with antifungals, which could be topical and oral. So these topical fungal infections need to be used regularly, and it takes a course of at least 6 to 8 weeks for this entire fungal infection to settle down. Some people, what do is they use these creams for say 1 week, 10 days, 2 weeks. They feel that it's all fine. They stop, and this infection keeps recurring. The most important way of applying this cream is to apply 2 centimeters beyond the infection. That is where the active fungal components are. The area where you're having itching or the lesion is usually a dead skin, and the fungus does not have anything to feed on. So the fungal infection is actually on your normal skin, so that is where it needs to be treated. And then we give some oral antifungal creams in order to put, if it is extensive and severe in certain areas like your feet, your palms, or other follicular areas that involve your scalp is involved, or it's more extensive, then oral antifungals are also added. So a lot of people who come with these fungal infections, who land in the clinic with fungal infection, have already self-treated and have aggravated the infection. So they would have used creams like Panderm, Foderm, Betnovate, Thinovate, Skin Shine, Fair Shine, don't know what not of shines, and would have aggravated and have gone into more stubborn kind of tinea infections, which do not usually come down with regular treatment. So there's a more extended period of treatment that needs to be done, probably 12 weeks or beyond that. So, and excessive use of steroid usually makes your skin more sensitive. You lead in having more broader and more aggressive kind of stretch marks, and then you might also see skin thinning. Then you see that your blood vessels are visible, that is known as telangiectasias. Sometimes you see acneiform eruptions on the body. The use of steroid also causes excessive hair growth on these areas. You might experience photosensitivity. So these are some really bad side effects of long-term use of steroids. So please do avoid self-treating yourselves. So this ringworm infection, also known as tamara or dad in the local languages, can actually be fully treated and you can get rid of the infection. Please maintain proper hygiene, wear loose fitted clothes and do not treat yourselves. Please consult a dermatologist for these kind of infections.